Okay, welcome everybody to CC Animals Health Continuing Education for Veterinarians. Today's subject is PEMF, a clinical and scientific treatment modality, and it is RACE approved. Our presenter is Dr. Laurie McCauley. Dr. McCauley acquired her DVM from Colorado State University, class of 1992. She is certified in acupuncture by IVAS, in veterinary chiropractic by AVCA, in canine rehabilitation since 2004, and she is a diplomate of the American College of Veterinary Sports Medicine and Rehabilitation since 2014. In Gray Lake, Illinois, she opened Tops Veterinary Rehabilitation and was the owner and medical director from 1998 to 2016. In 2016, she moved to the beautiful mountains of North Carolina, not too far from me, and opened up Redtail Rehab Mobile. She is the owner and medical director here in North Carolina. Among her many honors, she was awarded by the American Association of Rehab Veterinarians the Award for Excellence in the Field of Rehab, and in 2015 by the American Holistic Veterinary Medical Association Practitioner of the Year. We welcome Dr. McCauley.
Thank you, Carolyn. The one thing I didn't put on there was I just recently started Optimum Pet Vitality, an online platform. So
I'll
if you go to online
tomorrow.
Okay, yeah, sorry. You went through, I'm like, I never put that on there. Okay. Yeah, so let's talk about PEMF. We have all kinds of fun stuff to talk about today. Let's see if I can get, wait, there we go. First of all, thank you to CC for putting this on. I love that they put on RACE approved continuing education for all of us to learn from. Awesome, awesome lineup, guys, so thank you. So what is PEMF? PEMF is an electromagnetic wave, and I put a little box on here so you have an idea of what, and this is actually what the CC loop wavelength looks like. It's delivered by an antenna, hence the loop, or loops inside beds and things like that. It treats tissue through bandages and fur, which is a wonderful thing because then it allows us to, if they're in a cast or if they're a thick-coated animal, it gives us a modality that we can use that we don't have to shave and do other things. Really cool is it even goes through bone. Really, really important is that there's different variables in PEMF, and PEMF can be very different. So think about PEMF like a fruit bowl, right? So you can have an apple, you can have an orange, you can have a pineapple, you can have a mango. I think a mango is a fruit, all in this fruit bowl, and they're all very different, and they taste different, and they look different, but they're all fruit, right? So there's different types of PEMF, and they can do different things in the body, and we're going to talk about that. But I want to give you an idea of what the variables are. So you have a carrier wave, something who brings the electromagnetic field into the tissue. Duty cycle, which is how much time it's on and how much time it's off. You have pulses. So you can see here in the little box, right? These are pulses, and then you can have bursts. So you can have many pulses or a few pulses. You have the height in here. You can have how much energy is derived, and it's not just total Gauss. It's the energy under the curve, which is a different way of looking at it and actually creates different effects. And realize when we look at Gauss or all of our variables, more is not better. We want the right amount. So to give you an idea, you should have hopefully have heard of a bone stimulator, right? This is what it looks like. We don't use it on all fractures, but if we have non-healing fractures or malunions, we use it. It takes a long time. And that's a PEMF device. This is what that wavelength looks like, right? Totally different than this. Has a totally different effect in the body. Let's look at history. Way back in the 1930s, scientists came up with a Diathermy machine, which is the first PEMF machine, and it was on continuously. There was no pulses. It was just on or off, and they still use it. If you've been to a chiropractor or an acupuncturist, a lot of times they'll use this, and it creates deep heat, and it was used for wound healing and pain. Then scientists said, well, maybe we need to change the variables and not have the heat and see if we can still have effects in the body. So they looked at the body and they said, okay, well, let's look at what's the electromagnetic field of the body. Well, what is it if there's somebody who's walking, right? So there's concussive forces, there's changes. Well, what about if somebody's jumping? And they found some of these variables and said, okay, let's play with this. So in 1970s, they came up with the bone growth stimulators because they looked and said, okay, what are the bioelectromagnetic fields in the body when we have healthy bone healing as compared to a malunion? And can we apply that to the body for healing? Really cool fact is the bone growth stimulator and targeted, and we're going to talk about that a little bit later, excuse me, targeted PEMF are the only two types of devices that are cleared by the FDA. So remember, FDA approves drugs and clears devices. Back to bone growth stimulator. Some people said, well, is it
Oh, Laurie, you just cut out after back to bone growth stimulator.
Laurie, can you hear us? Oh, this is a first. Laurie, can you hear us? You have disconnected somehow. Oh, where'd you go? Julie, can you hear me?
Yes, I just texted Laurie.
Okay. The whole presentation disappeared off my screen. So.
Sorry, everyone. We'll just figure out what the issue is here and be back online in a couple of minutes.
Remember, I said how beautiful those mountains are in North Carolina. They're also difficult with internet. So.
She says she got booted out, so she's going to try to get back in.
Perfect. That's why I don't see a presentation on the screen.
And she is still trying to get back in.
Okay, thanks.
Sorry, everyone, she's still working on it. We'll be live in just a couple of minutes. Thank you so much for your patience, everybody.
Thanks, Julie. We all understand these things happen.
Everyone, she's just switching computers real fast, and then we'll be live again.
Thanks, Julie.
She says almost there. Sorry, everybody.
An extra long lunch break for everybody.
While we're waiting, if any of you guys want to start typing in your questions into the chat or the Q&A for Dr. McCauley when she comes on, this would be a great time to take advantage of a little bit of free time before she gets going again.
And we'll now also accept questions all the way through her presentation so that we're ready immediately with your questions when she finishes.
Share screen. All right, can you guys hear me?
Yes, welcome back.
My computer crashed.
Uh-oh.
So we are back.
Excellent.
So let's go back. Sorry, guys, that was a little scary. But we're back. So let's go back to where we were. We were talking about bone growth stimulators. I'll go through some of the bone growth stimulator stuff kind of quick. Good research, increasing osteoblast activity and looking at the markers that we look at for bone growth. And then we move into nitric oxide, really, really cool. It's the only gaseous messenger that we have in tissue, which is really cool. It's so cool, in fact, that it won Molecule of the Year in 1992. And Luis Ignario and his friends actually won a Nobel Prize in 1998 on all the things that nitric oxide does in the body and how it signals healing. And this is some of it. Works on epithelium, neutrophils, fibroblasts, vasodilatation, increases macrophages, helps with mast cells. Really cool. All right, targeted PEMF. We used that word before. So with the variables that a CC has, they have done the research to show that it increases calcium and calmodulin binding, which works with endothelial nitrous oxide synthetase, which is a mouthful, to increase short bursts of nitric oxide, because believe it or not, long bursts do a totally different thing in the body. So things that we see with this when we have these short bursts of nitric oxide, increased blood and lymph flow to decrease pain and edema. We see increased angiogenesis, so more blood vessels coming in. We have fibroblast growth factor, so creating collagen and granulation, transforming growth factor beta, so we have remodeling. And one of the things I want you to notice is this isn't just like, boom, it happened. These turn on and they have effects for immediately, but also hours, days, and even weeks. Some of the main things we see: vasodilatation, increased blood flow to the area. And understand that this happens in non-healthy tissue. So if we have healthy tissue, we don't see these effects, which is really cool when we talk about cancer. We have lymph vessel dilatation. So if we have increased fluid in the tissue, interstitial tissue, we can pull that out of there. It down-regulates pro-inflammatory cytokines, cytokines do things in the body, and upregulates anti-inflammatory cytokines and growth factors, and increases cyclic AMP. So that helps with cell differentiation and matrix when we talk about cartilage, all kinds of cool things. This is still on bone growth stimulators and how they help decrease inflammation. All right, how does inflammation cause problems? We need to think about this. It's not just, oh, we have a swollen knee. It's that if I have a nerve and there's swelling and fluid around that, my neurotransmitters actually get diluted. So I have less of an effect going across there. So we want to change that, right? We want the body functioning to the best of its ability. This is what we all think about. Okay, hey, I just realized I'm not in slide mode. There we go. That's better. When we have inflammation in the joint capsule, right, that's when we get, oh, kind of stiff getting up. What we also have to realize is the innermost lining of the joint capsule is where we have the cells that produce our inflammatory mediators, right? So they produce that, and then that goes in and creates inflammation, and then we have this thickening, and then we don't have good nutrient transmission to the chondrocytes. So let's look at that for a second. Chondrocytes, this matrix that we call type 2 collagen, or we call cartilage, right? It's 20% cells and 80% matrix, right? And most of the matrix is type 2 collagen. Well, the way it's avascular, so the way it gets its nutrition is you have load, which squeezes it down, and fluid or particles come out. They grab on their negatively charged, they grab onto positively charged ions, right? And then when you take load off, it goes back into the chondrocytes, or to the chondrocytes, and that's how it gets a lot of its nutrition. So when you have inflammation and you don't have good load, and you have changes in the synovial fluid, it disrupts that. We don't have that. So more than just in joints though, any place that we have red, inflammation, right? So in the mouth, if we have a gingivitis, that's inflammation, and that can create pain. Think about if you had that in your mouth, right? Anal glands, and we don't just mean that we need to treat abscesses or ruptures. If you see a dog scooting on the ground, he's not saying, hey mom, if you don't fix my butt, I'm going to make a mess on your carpet. He's saying, it hurts and I'm trying to stop that. Just the same way if you had a mosquito bite or you get bruised, you kind of scratch it or rub it, right? Because it makes it feel better. So if they're scooting, it means there's inflammation and discomfort. Every dog that has icky ears, right? Anything that's red is inflammation and pain. They shake their head, they have problems. Every dog that has a hot spot, that's redness, that inflammation in the skin, they scratch it because it hurts. But let's not just stay on the outside, let's go inside. Dogs with laryngeal paralysis, they get inflammation. If you've seen these patients and they're like, okay, and then they go outside. I used to live in Chicago, hot and humid, and they would have significant time breathing, right? Because there's inflammation in there. My old assistant had a dog with LARPAR, and a little embarrassing, came to me and said, hey, I'm on this blog on dogs with LARPAR, and they say that the Assisi loop helps with this breathing issue. And I have a hard time when it's really hot and humid in the summer taking my dog out, and I don't want to choose between you pee outside, but I don't want you to have a hard time breathing. And she would just put the loop on. I'd say, yeah, go for it, try it. She'd put the loop on before she'd go out, and he'd go out and he'd be able to breathe, right? That's really cool. Fibrosis in the lungs, we think, well, there's fibrosis, that's scar tissue. But there's actually inflammation around that. Little bit of an aside note, a couple of years ago I had the flu, and I'm a little bit of a nerd, and I had a stethoscope in my nightstand. All right, that's a whole different story. But I listened to my chest. I couldn't get up. I was like, oh God, it's just, I don't like being sick. I don't have time for this. And I heard crackles in my chest, and I'm like, crap. Okay, I'm a scientist, and my nose was stuffed, and I'm like, I have to be able to fix this. So I also have an Assisi loop on my nightstand, and I'm like, okay, I'm going to put it on my left side. I'm going to put it on my right side. I put it on my back. I put it over my nose, like a hula hoop around my nose, and my nose cleared, and I could breathe, and my crackles were gone in my chest, and I'm like, this is really cool. So let's bring it to like 2 months ago, a month ago, and my sister-in-law called me and said, okay, I knew that she and my brother had COVID, and she said, Laurie, I'm really scared. Rich has chest pains, and when I asked him if he wanted me to take him to the hospital, which in New York is really scary, he didn't say yes or no, he said, which one? And my brother's a big jokester, so that meant he was scared. And I said, okay, what can I do for you? What can I do for you? I said, okay, she had a paralyzed dog, and I had used an Assisi loop with them for that, and the dog was walking. It was great. I said, grab that loop, wherever he has the most pain, you put it on his chest, and every 15 minutes, I want you to move it to a different quadrant. And my brother's a pretty big boy. He's big enough that I wanted to make sure she treated the front and the back of him. They never had to go to the hospital, right? So I'm not telling you that to say, woohoo, I thought of something really cool. I'm telling you that because it's COVID, right? And we all deal with that. And if someone you love has something like that happen, you at least have that information in your toolbox. Let's keep going. Pancreatitis. We know that when an animal or a human has pancreatitis, that there's pain involved. There's inflammation. These guys can be treated and have better quality of life and better function and decrease inflammation so the cells can work better. And what about all of our cats that have, or dogs, that have kidney disease, if they have, or liver disease, right? If there is any inflammatory component and we can increase blood flow to this non-healthy tissue and get it functioning better, we're doing what we're supposed to be doing, which is helping animals. All right, let's go back to targeted PEMF for a little bit. So we've talked about Nobel Prize and nitrous oxide, and that's really cool. Well, Arthur Pillis said, hey, let's figure out what the best PEMF variables are to have the most effect on nitric oxide. And he took those variables and published it. And that's what targeted PEMF is. The best variables to have the most effect on nitric oxide. And then they said, okay, well, how do we take this and use this to help people? And they got it FDA cleared for humans with postoperative pain and edema. And what they found when they did the research, really, really, really cool. If double-blind, placebo-controlled, really well-done study, enough for the FDA, the patients that had an active device actually had had a 50% reduction in opioid use. Not just less opioids, half. Pretty cool. So 2 common devices that you probably are aware of, the Otto Cycle. So this is one that you turn the button on and it goes on for 15 minutes every 2 hours until the batteries die or you shut it off, right? So when would I use this? Amputation, a Hemi laminectomy, a thoracotomy, something where this animal needs to be treated constantly. And you say, well, you just said it's every 2 hours. When we turn the nitric oxide cascade on, that effect in the body lasts about 2 hours. So if we treat every 2 hours, it's almost like we have a continuous effect. Now you say, okay, well, my horse has a laminitis, but I can't stay with him all the time. Okay, so you can put it on his hoof and treat him twice a day when you go riding, or 4 times a day if you're hanging out with him. So this device, actually, when you turn it on, it's on for 15 minutes and it shuts itself off. And why is the time 15 minutes? Is because when they looked at it, they said going longer doesn't help. So if you treat and you turn on that nitric oxide cascade, you don't want to waste your batteries and treat again because you're not really giving any more bang for the buck. Wait 2 hours and then do it again. Also comes in pads. So you can see here the cat's on a pad. And the pads can be put in carriers, which is really cool. So this one, cat or dog can go in. Same thing here, small obviously. Really cool. I know clinicians who all of their cat patients, when they come in, they get put in the little carrier for 15 minutes while they're waiting for the vet to come in the room. And when the vet comes in the room, it's a nicer, happier cat. I feel better. I'm more relaxed. Life is good. I can tell you, I lost my 18-and-a-half-year-old dachshund last September, and probably at least the last year of his life, he would have this therapy for cognitive dysfunction, right? Because it has an effect the whole height of the carrier. You say, okay, how do I know that? This is what the field looks like. So think of it like a barrel, and it goes about 8 to 10 inches on either side. So if you have it in here, it's treating 8 to 10 inches up. Now, for me and for most people, unless you're like 6'6" and a basketball player. If I do a Hawaii sign, and you can't see me, but if you did a hang 10 sign, from the end of your pinky to the end of your thumb is 7 inches. So even if you said, okay, I can do that anywhere and know that I'm going at least that deep into the tissue, you have a good idea of what the field looks like. And my dog did better with his cognitive dysfunction. And 18.5 isn't too bad. All right, they also have this wearable, which is like a little jacket. It's a loop aid that you can Velcro the loop on. So if there's an area like a shoulder or a back and you want to put it on the dog and not have to hold it, you've got a way to do it. Let's look at cases, right? This is Roxy. This is a perfect case because Roxy came to a clinic, a friend of mine, Amber, in Chicago. She is a rehab specialist. She's going to get board certified, and her husband is a boarded surgeon. And Roxy came as a rescue, right? So shelter, no money. What can we do to help this dog? This was her original x-ray. So you can see she has a head and neck fracture on the left side and a major non-healing fracture on the right side. Doesn't really want to put weight on her legs, her back legs. So they said, okay, we'll do the surgery. So this is post-surgery to get rid of the bone fragments here. And we will do range of motion and the Assisi pad. They got a Clinica. So this is her before therapy. You can see she's totally roached, right? She's pulling her weight forward. I don't want to put weight on my legs. I'm uncomfortable. My head is down. You see her, she's got her front legs way underneath her. Amber's comment to me was, we put her on the mat for the first time when we had a staff meeting. And when she got up, we all looked at each other and went, holy cow, this is a different dog. So again, all they did is range of motion and the Assisi Clinica pad. And this is her 7 days post-surgery. Look how much flatter her back is. Her head is up. Now, she still has 2 fractures, right? So she's not perfect, but within 7 days, that is amazing. Here we are at 30 days. Head is up. She's got her weight pushed back when she's looking up at the camera. Look how much better she's walking. So much better. And she got adopted. Yay. Okay, let's talk about other PEMF, right? Pulse signal therapy. I have this machine too. This was the first one I had. This was the second one I had. This is what it looks like for humans. You say, oh, I haven't seen that. Well, it's for humans in Germany. When I asked the inventor of this machine, who a brilliant man, Richard, why don't you do this in the US? And he said, Laurie, it would cost me $22 million at least to get it through FDA approval, and I'd be fighting Big Pharma. I have a great business in Germany and in other places in Europe. Not worth it to me. Like, okay, well, thank you for bringing it for animals, right? Totally different variables, totally different effects in the body. I would not use it for pain. I would not use it for inflammation, but holy cow, it works great for osteoarthritis. There was a study done using 9 one-hour sessions, 9 consecutive days. Some of the interesting things about this, let me back up. So it was done by pet owner questionnaire. So not the best study, but okay, it was published. Polarity in this case is important. So, and I saw this because I had patients who would use this when we were not in the building, and we had to put a sign up here that said head at this end, because the patients where they came back here and walked in and treated the animal and then came and left did great. And I had one client who I adore, but wasn't the smartest cookie in the jar. Didn't care which way the dog sat, how he moved, and we knew polarity was important. And he sometimes sat this way and sometimes sat that way, and the dog didn't have an effect. So needless to say, we discussed it with him and we did it again, and then he had a great effect. With this, it means that the pads have to go on the same way. We have it written on the pads, and we say, okay, set yourself up, set the dogs up, always look at it and be able to read the writing. set it up the same every time, and you'll do great. This was a poster. Again, what does it do? What they show, the mode of action, is that it increases chondrocyte mitosis. So you have cartilage cells dividing. So it's not a fast fix. You actually don't have full effects until you're at least 12 weeks out. But they've shown that you have that. And think about this. Remember, if you're older like I am, you have the old Clairol commercial. She told 2 friends, and she told 2 friends, and so on and so on. I had patients that within a week, the dogs got better, and I had patients, well, I'd say 10 days. And then I had some that 10 weeks, all of a sudden, it was like a light switch, and they were better. What it works for, it works really well for. Respond has a PEMF device, and I have friends who have it in their clinic, and they'll do their acupuncture on it, and they say it works great, the dogs relax. Again, totally different variables. So they have a different carrier frequency. They have a different duty cycle. They have pulse frequencies of 5, 10, and 15. And we know that their Gauss is 15 Gauss. They say that it works for pain relief, neurological input, reduce inflammation, increase healing, help with calming. But and people can see some of this stuff, but we realize that there's no clinical study. So we don't have a mode of action for what's going on in these dogs. Also, more recent out there is Beamer. I will go through the Beamer studies. I want you to know that I didn't just randomly pick these. These are every single study that has been published in a peer-reviewed paper. Okay, so these studies, the first one, 30 humans with complex regional pain syndrome type 1. So this is not something we see in dogs, but I wanted to be thorough in presenting this information. So this is, you have trauma, and then you have all these weird, painful sensations. It can be depression, anxiety, abnormal sensory motor changes, sweating, allodynia, which is pain from a non-painful sensation, hyperesthesia, pain way more than it should be. And they looked at VAS, so visual analog score, and they treated these patients either with rehab, physical therapy, and PEMF or not, realizing that the participants didn't know if they were getting treatment or not, but the doctors, the physiotherapists who flipped this machine on or off did. So it's not quite double-blinded. It's not double-blinded. It's single-blinded. And they looked at beginning, 10 days, and a month later. And what they found was at the end of treatment, 5 of the 15 had a reduction in visual analog score compared to 0. So a third of them compared to 0 with placebo. I've been doing rehab for 22 years. And my first thought is, what do you mean? I do rehab all the time. If I had 10 treatments and I didn't have any patients do any better, something would be really weird. But okay, 1 month later, they had 8 patients that had a better significant change in visual analog score compared to 2. So 2 would be considered a placebo. Next study, looking at, so this was a study looking at cells in a petri dish. And they said, okay, well, we want to use the Beamer technology to see if we can make them more sensitive to chemotherapy. Okay, so they took these cancer cells and they did find they had a significant change in glycolysis and tricarbolic acid, but that did not sensitize them to the chemotherapy. Another study looking at pain and other symptoms from fibromyalgia. In this study, there was no difference between the active and the sham treatments. So outcome from that is Beamer does not help in pain and other symptoms from fibromyalgia. This was looking at fatigue in patients with multiple sclerosis. They did a double-blind crossover, which meant for the first 12 weeks, nobody knew what was going on. And there was no change in fatigue in the patients with multiple sclerosis. So they said, okay, instead of 37, half of them have it active, half of them don't. We'll just take the people that didn't have it active, so it's a crossover, and treat them for 12 weeks. And there was no change. So then they said, okay, well, if you want to keep the machine and use it, we'll check back with you later. And 3 years later, they came back and said, okay, we did another questionnaire, And there was a significant change. And my thought is 3 years later, who knows what else changed, but that was their results. And this one actually had positive results. So they had 15 patients with lower back pain and 17 patients with knee osteoarthritis. And they did three weeks of rehab and Beamer, or 3 weeks of rehab and a non-active unit. And they were hoping to increase microcirculation and reduce fatigue. What they found was in the osteoarthritis side, there was no change. Okay, so that didn't help that. But in the patients with lower back, so 15 patients with lower back, they did see a significant difference in visual analog scale and the fatigue scores. The other thing they looked at is an oswestry, which is a disability score and quality of life score. And in both of those, in both sets, so lower back pain and knee patients, there was no change. So now I want you to look at PEMF targeted versus PEMF non-targeted. Oh, sorry. Actually, this one was the FDA cleared for human study. So when they looked at that, and all of these have the research study at the bottom. So this was a 2010 study. They looked and they found, they took women that had breast cancer and used either an active or inactive loop. And what they found was that the women that had the active loops had significantly less inflammation. They had significantly less drainage, so their drains could be removed earlier. And in the fluid that they did drain, had significantly less interleukin 1B, which is one of the inflammatory markers. And most important, 50% reduction in narcotic usage. And that's not the only study that have been done with breast surgeries and using this therapy. And in all 4 of these, they had less pain, less narcotic usage. They were treating 20 minutes every 4 hours. They said they had reduced pain, so visual analog scale, 50%. And again, less drugs. Realize that you can treat any tissue with this, whether it be a bird, a reptile, a cat. Again, it's FDA approved for humans, which is really nice. My clients often will say, well, I used it on my dog, and then I used it on my hip, and I have to go, la, 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 I can't hear you. All right, now we can look at the studies of targeted versus non-targeted. So these are 2 very close studies, that one is using non-targeted PEMF and one is using targeted PEMF. So we can compare it. And what we see here is in a non-targeted PEMF study in osteoarthritis pain. With these patients, they were treated for 12 hours a day, and we had a 25% reduction in visual analog pain or scale. So think about it, if I was in, right, so visual analog scale from 0 to 10. 0 is no pain, 10 is, oh my God, I want to die, the pain is so bad. So that's going from an 8 to a 6 or a 4 to a 3, which is good. 26% of the participants were able to get off NSAIDs. That's good. But let's look at targeted PEMF. 30 minutes a day, significantly less time compared to 12 hours. And instead of dropping them from dropping it 25%, it actually dropped the pain score by 50%. So that's now taking this patient that has a pain score of 8 to a 4, or from a 6 to a 3, right? So huge. And it's not just, okay, it worked, and then it stops working. 42 days later, they still had significant pain relief, which is cool. And with the sham, there was no change. Let's look at a dog study. Those are always really good. Canine osteoarthritis study comparing Previcox to PEMF. All dogs, so 20 days of either Previcox at an appropriate dose or PEMF twice a day. What they found was both groups did really well, but when they took the dogs that had the Previcox off the Previcox, pretty quickly the pain came back. Whereas the dogs that had the PEMF, and the PEMF machines were removed, the clients couldn't just keep using it. 4 months and 12 months later, the dogs were still significantly better than when they started. So it's healing, not just clinical signs. All right, research, yay! Rats, poor rats, they get used so much, but they are so consistent. So we know if I do A, I expect B, and it happens consistently. So they use them for a lot. So these are actually done with CC loops. Changes in pain tolerance and decreased in inflammation or edema, right? Significant changes. Another study where they cut the rat's Achilles tendon, sewed it back together, treated them twice a day for 3 weeks, euthanized the rats, and then took a machine that says how much tensile strength, how much healing has happened, how much pressure does it take to make that little tendon pop? Well, they found that the patients or the rats that had an active loop or a loop twice a day for 3 weeks was 69% stronger. It's huge. If I want my patients, this is a tendon, that have a tendon or ligament issue, I want that to happen. Okay, where do we think about that? Now, this is tendon, but if I had a partial ACL tear, that's ligament, it heals slower, but I want to increase the tensile strength so that we don't tear it all the way, that would be a definite for me. I love this one. This is rats where they said, okay, let's do a flap, and half of them get treated and half of them don't. 500% in neovascularization. Huge difference. In fact, all the rats that had the treatment, the flaps lived. All the rats that didn't have the active treatment, the flaps died and turned necrotic. Another study on pain and edema. Again, looking at not just the Achilles tendon in rats, but also full thickness skin wounds. They healed 59% faster, or 59% more tensile strength. Let's look at more dog studies. Okay, this is new. This is 2018. North Carolina State, woohoo, I love North Carolina. Double-blind, placebo-controlled, randomized study. 16 dogs with IVDD and paraplegic, right? They had surgery. They put on that loop that has it going on 15 minutes every 2 hours, either active or not active, right? Because it was double-blind. And they did that for 2 weeks and then twice a day for 4 weeks. What did they find? They found significant difference in incisional pain. So does it hurt if I touch it? And the more treatments they had, it was a biocumulative effect, the more effect it had. They also found better proprioception at 2 and 6 weeks. That's awesome, right? Better neurological effect. Big one. They looked at GFAP, which is a marker for nerve damage. And what they found is that the dogs that actually had an active CC loop on their back had significantly less GFAP, which means they had significantly less nerve damage. That's really cool. All right, AMC. If anybody has done an internship at AMC, you know it's an amazingly cool place. All kinds of patients. Just awesome. I did a short internship there. Well, Leilani Alvarez did a study, again, double-blind, randomized, placebo-controlled. 53 patients with Hemi laminectomy. That's awesome. Naturally occurring IVDD, non-ambulatory, so not walking. And they did it. They didn't do it every 2 hours. They just did it 4 times a day until they went home, and then twice a day for 7 days after they went home following surgery. And then they measured how much pain meds. So kind of a different twist on it. And what they found with these guys is that they had better wound healing. They did look at that. Just like in the humans, 50% less opioids. So codeine was administered 1.8 times more frequently in the control group. That's really cool. And as always, we want to make sure there's no side effects. None were seen. Wound healing. This is an amazing study. It was done in a VA hospital with people who are either have bed sores or wheelchair sores, non-healing. They've been there for a long time. They went in Monday through Friday. They said, we're going to treat you in the morning. We're going to treat you at night. And then we're going to see what happens. And again, double-blind, placebo-controlled, really good study. And what did they find? The patients, the humans that had an active loop, 64% of the wounds had closed in. They were 64% closed. Whereas the patients that didn't have an active loop, it was actually the same to worse. Okay, huge difference. Don't just take my word for it. Jamie Gaynor, who's one of my heroes, he's a guru in pain management. He has this publication through Elsevier, Veterinary Applications of Pulse Electromagnetic Field Therapy. If you're a geek like me, woohoo, yay. He has this publication, and you can read all, I think it's like 8 or 10 pages. Pages 1 to 8. So it's an 8-page paper on PEMF. Highly recommend. It's a good read. His words were, targeted targeted pulse electromagnetic field therapy is 7 times more effective than non-targeted pulse electromagnetic field therapy. Huge. So what do I use it for? Well, we went through some stuff, but I want to highlight, and there's 3 pages of this, so I'm not going to read it to you. Otitis, right? Allergic reaction with difficulty breathing, anal gland abscess, ACLs, CCLs. Really cool. A friend of mine called me up and said, Laurie, I've got this case. Neurologist said it's cerebellar abiatrophy. It's this cat, and he's falling over, and he can't walk, and it's crazy. And this client loves this cat, but she doesn't know what to do. And I said, I treated a Kelpie with that once, and if I remember correctly, it has an inflammatory component. Neurologist said, I don't know what to do with it. I said, try an CC loop. She calls me back 3 weeks later and said, oh my God, the cat's almost normal. This is amazing, right? Who would have thunk? Anything you have inflammation, think about it. Cervical disease, cystitis, dental extraction, any kind of pain in the face, the mouth. Wrong direction. Here we go. Fragmented coronary process, hemorrhagic enteritis, anything that is an itis, right? Hips, IBDD, kidney disease, LARPAR, lumbosacral, megaesophagus, oral ulcers, right? Any kind of osteoarthritis. I will tell you, with osteoarthritis, it takes a longer time. It's not a quick fix. It took a long time to get there. We have to heal the tissue. Pancreatitis, patelloluxation. Are you going to fix patelloluxation? No. But if they're painful from it, you can decrease the inflammation and pain. Seromas works really well with seromas. Sinusitis, spina bifida, upper respiratory tract infections, urinary obstructions, wounds. Okay, we talked about how variables are extremely important. Let's look at a different set of variables. So a new way, a new avenue for this PEMF therapy. Did you know that 14 to 22% of dogs have separation anxiety? It's the only behavioral thing that causes, that they have 2 drugs for to help treat it. Calmer canine actually works in the amygdala, the little part in the middle of the brain that works with the serotonin and dopamine and endorphin. And they did some research to look at these guys, and they looked at panting and pacing and barking and howling and whining. And you say, well, why did they even think of that? Because there's lots of research in humans looking at using PEMF devices to have an effect on the brain. And right in here, that's the amygdala, right in the middle. Calmer canine, they did research again at North Carolina State. Margaret Gruen, neat lady, used it 15 minutes twice a day, 8 to 10 hours apart. They did videos. They watched lots of videos and did questionnaires. They did it baseline to make sure they had true separation anxiety and not anything else. 1 week, 2 weeks, 4 weeks, 6 weeks. They took the device away and said 2 weeks later, okay, is it still working? And what did they find? Really important is that they did not use this, they did not include dogs with other phobias because they wanted to be strict on canine separation anxiety. 56% of the dogs had a reduction in canine separation anxiety clinical signs within a week. 100% of them had decreased clinical signs after a month of therapy. And at the end of 6 weeks, 50% of the dogs had all signs removed with no side effects. But the proof is in the pudding. This is Elliot. He's a 3.5-year-old male beagle. You can see him howling. He is chewing and not a happy camper and chewing more because he is frustrated. He is not a happy camper and he's howling and howling. And chewing more. And chewing more. Pacing. Howling. He's looking up at the camera. I am so upset. 1 month later. Hey, look, here's my toy. I'm a happy boy. I think I'll lay down. Maybe I'll play with my toy. Maybe I'll just sleep. Ah, life is good. I don't have to chew anymore. Oh, look at my toy. So, what percentage of time? Before, 24% of the time he was happy, 80% he was upset. I'm sorry, 71% of whining and howling. A month later, 80% of the time he was happy. Oop, and I missed the rest of it. But you saw he had really good results. Things to think about, precautions, large amounts of steel, right? Don't use this therapy on a metal table. It's not going to hurt the patient. It's not going to have anything bad happen, but it totally changes the field and you're not going to have the same results. So don't do it on a metal table. Don't do it on a non-metal table that has large metal legs or in a metal cage. Do it on the floor. Do it in if you're in a clinic where you don't have a lot of non-metal things, put up a plastic X pen. Put up a playpen, right? Other things, pacemaker. If the pet has a pacemaker, don't do it. If the client has a pacemaker, you can do it, but the patient should be below and the loop should be below the waist level of the person. And then with oxygen, all electronics, anything that has a battery or plugs in should not be used around oxygen.